Happy New Year, everyone. Thank God for bringing us into another amazing year. 2025 is going to be a beautiful year for every one of us. And I pray that every of our heart desires, God is going to grant them unto us in Jesus' name. So today, I want to be talking about convulsion and how to manage this situation. Convulsion is one of the leading causes of death among infants and children. Convulsion have caused a lot of damages to a child's health. And that is the reason why I am here to tell us on how to manage convulsion. Convulsion can be very, very alarming and distressing to parents. So as a parent, these are tips that you need to follow in order to manage the situation. First of all, let's know what causes convulsion. The first thing that causes convulsion is high fever. When fever is high, when the temperature of a child is 40 degrees Celsius and above, it can lead to convulsion. The another thing that can cause convulsion is infection. Infection like meningitis, encephalitis, bacteria and other viral infection. It can lead to convulsion. The another cause is birth asphyxia. Birth asphyxia occurs as a result of low oxygen rates in a newborn. When a child is born and the oxygen rate is very low, it can cause convulsion. The another thing that can cause convulsion is genetic conditions. Yes, genetic conditions like epilepsy. Yes, it can cause convulsion in a child. Then head injury can also cause convulsion and seizures in a child. So now let's know types of convulsion. We have febrile convulsion. This is the most common type of convulsion in a child. This occurs as a result of high temperature. Yes, when your child have high fever, it can cause convulsion. This is known as febrile convulsion. Then another one is neonatal seizures. This occurs in infants. Babies born, babies that are just newly born, like 0 to 28 days, yes, as a result of infection, birth asphyxia, yes, this is known as neonatal seizures. But today I'm going to be focusing on febrile convulsion, which is triggered by high temperature. So in order for you to manage convulsion at home, the first thing that you need to do when your child is convulsing is to stay calm. Try as much as possible to stay in a relaxed state, because when you are relaxed, you can be able to think of the next thing to do. We have seen cases whereby mothers are screaming and shouting. Neighbors will gather and give you different ideas and suggestions that will even complicate the issue further. Some will tell you, put spoon in the child's mouth, put salt, put pepper, place the child's leg close to the fire, it will awaken the child. This will only worsen the situation. So try as much as possible to stay calm. Then the next thing that you have to do is to place the child on one side. Place the child on one side and lose every tight-fitted clothing. Yes, every tight-fitted clothing that is on the child, make sure to lose it. Then the next thing is for you to make sure that the environment is safe and free from hazards, so that the child will not injure him or herself. Then allow the child to move freely. Do not restrict the child. Allow the child to move freely. Then time the minutes the convulsion lasted. Because when you go to the hospital, after the episode is over, the doctors will ask you how many minutes did the convulsion last. Then last thing, do not put anything in your child's mouth. Don't do that. Do not put anything in your child's mouth. So this will help manage the situation. Then you can seek for medical attention by rushing your child to the nearest medical center. Then in order to prevent convulsion from happening, make sure you vaccinate your children. As health workers, we go into the community to vaccinate children. Do not stay behind. Not vaccinating your children will put them into grave danger. This is one thing you owe your children. Health workers, doctors, nurses frown at negligence of some mothers that refuse to vaccinate their children. If you don't vaccinate your children, you are making them to face great dangers in the future. So vaccination will help curb the spread of infection, which can lead to convulsion in your children. Then the next thing is manage fever. Yes, when you see that your child's temperature is overly high, try as much as possible to manage it by doing this thing we call tepid sponging. I've made a video on tepid sponging. Tepid sponging will help reduce high temperature in your child before you then give your child antipyretic drugs like ibuprofen or paracetamol or any antipyretic drug that is prescribed by your doctor. If you follow these tips, then we can be able to save lives. Instead of putting things in the child's mouth, instead of listening to what the neighbors are saying, make sure to get every information that you need from your healthcare provider. Do not self-medicate at all. Babies are very, very tender. Their immune system is not that very strong. So before you give anything to your child, make sure to seek medical advice. And please, mothers, your child should stay healthy. Give your child enough good nutritional food, things that will make them grow strong, things that will build their immune system so that they will be able to fight against infection. Thank you guys for listening, and I hope that you've learned something today. Follow for more. Bye.